Now, to the serious stuff. What I wanted to do, it's all working, is basically take what Andrew said. And one of the issues that Andrew mentioned there was there are numbers of aspects of wellbeing policy where we don't know the answers. The age point is an example. What I'm trying to do is get us to the situation where we can think about, and this is what I've been doing ever since I stopped being Cabinet Secretary, thank you, is to think about what government's really for, right? And I mean governments in general. So what are they trying to achieve? And I sat down with various prime ministers and asked them this question. Most of them are like, well, get re-elected, things like that. You know, some of the more sophisticated, we did have a discussion of GDP versus GDP per capita, but for all the reasons you said, GDP is an activity measure. I mean, I get so bored going through the wide GDPs. I mean, surely we've gone beyond that. So when you start talking to people about let's improve people's quality of life, then you start to kind of, yeah, well, obviously it's about that. When you say, well, actually, no, it's not obvious. And no, you don't actually act as if it is. Some of your policies aren't consistent with that. And so let's think about what it would really mean. So for me, this is the thing I would like to write if I ever get the time, is the book about what government should really be doing, right? And what the objective should be. And if you follow that objective, what would it mean for policy change, right? And I'll say a little bit about what one can say already about that on the basis of what we already know, which is, to give you the bottom line, all tied up in a thing that I produced as an all-party parliamentary group. We've said, if you are having a spending review, brackets, we won't be having a spending review. We're in a complete mess. We can't do a spending review at the minute. Normally, we'd be having a spending review this autumn. We'll at best have a one-year rollover, but we'll get a spending review, but it will be some way down the track. It'll be a bit too late. It will be towards the end of this parliament. Just be a mess. But if we were to have a proper spending review and in a fixed-term parliament system, you might think a new Prime Minister would say, let's do a 5-year spending review. Let's actually have something where we do the budget, not just about tax, but about tax and spending together. And let's have budgets to be 1-year course correction devices to actually plot the path through. And the whole objective of all of this will be to improve the quality of life, the well-being of the public. Wow, right? We're miles away from that. But let's think about what might get us there. So first, and I've got 5 steps to this radical change. I know I haven't got long, so I'm going to whiz through these. My 5 steps are, number 1, win the intellectual argument. That's what most of you are about. You've got to do that for me. Number 2, get the public on side. Number 3, convince the politicians. Number 4, get the people in power to prioritise well-being. Number 5, ensure the policies are implemented. All right? All 5 things, absolutely essential. If you look at, say, climate change, win the intellectual argument. I think we can give that a tick now. Getting the public on side, coming more and more along. Convincing the politicians, sort of. Getting the people in power to prioritise climate change, not happened yet. They all say it, and they'll all say it far more at the next election. But when it comes to actual policies, it's really interesting how they go, oh, well, you know, fuel escalator, ooh, you know, might be unpopular. Ensuring policies are implemented. Again, we've got some way to go. You could do exactly the same for the 5 tests on behaviour change. Really interesting. Winning the intellectual argument. Actually, more and more we're starting to win the intellectual argument. Getting the public on side, sort of, you know, books like Nudge, getting there. Convincing the politicians. I wrote a thing in behavioural public policy about why the politicians really don't do behaviour change stuff well. When was the last time you heard a politician talking about the behavioural stuff? The truth about behavioural stuff is it doesn't bring political credit to the politicians because it's the individuals that change their behaviour. What politician has got the credit from auto-enrolment, one of the most important, significant changes? No politician, right? They look at this stuff and go, you know, yeah, okay, Gus, really good idea. Come back later. Getting the people in power to prioritise behaviour change. Again, one of the ways I've sold it most in behaviour change is it's cheap. and it actually is very effective. So ensuring policies are implemented, training the policy professionals, that actual work is going on, and there's now, I'm glad to say, nudge units around the world in various countries. So the intellectual argument, why is that difficult? Well, I think Andrew typified this. As academics and the whole university infrastructure and incentive structure is very much single disciplinary. Andrew highlighted the fact this is highly multidisciplinary. You've got papers there with psychologists. If we're going to win the intellectual argument, we need to get the philosophers around and all the rest of it. So when it comes to something like climate change, I'll give you an example of that in government. They won the intellectual argument on the science side, first of all. How important are scientists in government? Tara will know this. Very little, right? We've got government chief scientists who are really, really good at talking about the science. Are they really good in being influential on policy? No. The great thing about economists is economists are invasive, right? We took over policy areas, right? We really like changing policies, right? You take the social researchers, really important, but not actually as influential in, say, somewhere like the Treasury as the economists, who basically, like me, said, right, we need to get in there and mix it. We actually want to do stuff. We don't want to say it. We want to be professional and influential. We actually want to change policies. So the multidisciplinary, and this is my my slides, if I can get this thing to work. Here we go. That's my kind of highlight, the behavioural stuff. Who was seen as the champion of behavioural stuff? Won the Nobel Prize in economics, a psychologist. If you ask Danny came to see me when I was cabinet secretary. We sat in the room and talked about this stuff. We talked about behaviour change, we talked about well-being, long before he'd won the Nobel Prize. And it's really interesting that we've got psychologists winning a Nobel Prize in economics. Where's the Nobel Prize for well-being? Which discipline would it go to even? So we've got some way to go there. Moving on from the intellectual argument, which you'll know a lot about, to the public. When you think about, sorry, that should come later. When you think about the public and you talk about well-being, the first thing you get is smashed avocados and spas, right? If you look at the reviews in the Sunday newspapers and the rest of it, there is a lot about well-being, but it's mostly about diet, about health and exercise and that sort of thing. All of these things are quite important in their own way, but we haven't got to this situation of basically getting the well-being and policy lined up and how government should act. So there are some issues there, I think, with the public. There's also some issues about balancing the positive and the negative. So when it comes to, Andrew talked a lot about what I would regard as the negative side of well-being. So one of the things that we know from the work that's been done on well-being is what hits you as the number one policy prescription is, for God's sake, put more money into mental health, right? For God's sake, do more on prevention. So that means children's mental health, really important. Making sure that we actually treat people we diagnose with mental health, which we mostly don't do with mental health illnesses. We mostly don't do now. Curiously enough, we do tend to treat people who've got broken legs, but if you've got a broken mind, chances are you'll wait a very long time to be treated. So there is a very big fundamental issue there about the positive and the negative. So the reason that concentrating on the negative makes a lot of sense, this is something which is also quite crucial for policies. Is the policy goal to improve the average level of well-being, or is it to reduce inequality in well-being, or is it both? Now, there are some philosophers, to my surprise, who say it's invalid to be talking about inequalities in well-being. I don't buy that personally, but there is, to my surprise, a debate out there. If you want to increase the average level, it turns out the simplest thing to do is to start working on getting the negative up, the misery people up. So mental health, again, comes out as the number one policy you would change, is putting a lot more money into mental health. And it turns out that that has all sorts of other positive effects as well. So that would be about improving the inequality. And the good thing about that is, to my mind, we know quite a lot about suicides. Once people analyse that, there's not a lot of analysis out there about people who are pretty happy and how do we make them blissful, and do we really care? Right? I'm not that bothered about moving. I know Andrew mentioned candle ladders, but ladders of people who are. We average about 7 and a bit on a 0 to 10 scale. People who are at their 8s, putting 8s into 9s or 9s into 10s. I'm not that fussed about that. Getting people who are 2s up to more like the average, that to me seems to be the thing we should do. The other part I should mention on all of this about the public is language. When I talked about well-being, the thing you'll get from politicians will be 2 things. One, this is all fluffy. This is all subjective. There's no real data or science behind this. And I think Andrew and his work and many others have shown that's not true. And they don't like the words. They don't like the word happiness. They don't like the word happiness because this is Aldous Huxley. This is soma tablets. So what are you going to do? Wire everybody up and keep them really happy? That's what you're suggesting, isn't it? We maximise their happiness. I had a variant of this, which was, I can't actually say on camera, so I have to be careful. But, I mean, there are things you can do to make very older people very, very happy. You can imagine giving them cocaine free, for example. Is this really sensible? Anyway, I won't go into that area because it's very dangerous. But language, I would really love to get the right word for this. I don't think it's well-being, I don't think it's happiness, because they've both got other connotations. I've thought about, is it quality of life? I don't know, but it's actually making people's lives better. And that's partly about their subjective feelings about their lives, and there's other things about other aspects of their life that are important as well. So that's the public. The politicians, this is where it gets me to here. Now, David Cameron. One of the reasons I was really pleased to be here was because I thought it would be the first time in a long time I wouldn't have to talk about the B word, Brexit. But you've already talked about it quite a lot, I've noticed. And this, to me, is bliss, not having to talk about it. Here's the man who clearly his memoirs will be out in September. And I think his chapter on Brexit will be interesting, and the referendum, why he chose it. I suspect it's been rewritten about 6 times. What will he be remembered for? Well, will he be like Tony Blair, it's all about Iraq? Well, for me, David Cameron will be remembered, and this is where I'm looking up positively at him as we're launching the ONS data to actually start measuring subjective well-being, the 4 questions. It's now an official statistic. To me, having been trained here by Farouk, people will remember Farouk doing the econometrics. The X's are fixed. I just remember it brilliantly. Taught me econometrics early on. Data. You can't do anything without data, right? We started getting that data in 2011, 2012. We haven't got a full economic cycle yet. But without that, Andrew could not have put up that chart on the age thing, that was ONS data. We never used to measure this. We now have that. Big sample size, we can do lots of regional stuff. It's kind of, I was going to give you a list of the surveys which actually include the 4 ONS questions. It's too long. Just, it's massive now. And we're starting to use it in all sorts of different ways. So, God bless David Cameron. That was hugely important. And it will allow you to answer all those sorts of questions. And the ONS did, in fact, engage with the public and went round and had roadshows. And I think it's quite interesting how that had some relationship with the politicians. So, how are we getting on with the politicians? Well, here are 3 who I'm sure you all know. So, who knows who the woman in there is? Hands up. Not that big a list. Okay, that's Jo Swinson, one of the 2 candidates for the Liberal Democrat, to be head of the Liberal Democrats. Jo is very interested in well-being stuff and will pursue it if she becomes head of the Liberal Democrats, which is interesting. And I've spoken to her a lot about these sorts of things. John McDonnell, one could argue the power behind Labour at the moment, is very interested in this stuff. And it'll be interesting to see if this evolves through to their policy. The interesting debate they have is well-being versus poverty, right? The kind of Corbyn end of the Labour Party thinks that if we talk about well-being, we're somehow dismissing poverty as a problem. I can't quite get my head around this, but that's the issue. And there, Matt Hancock, he had a really good leadership campaign, didn't he? Because he came out and said that actually well-being was one of the things he was really interested in running as what this should all be about. But Matt now is a big backer of Boris, is hoping for a big job, clearly. But they've probably been promised to a lot of people. So there we go. So there is progress across governments. When we look at here we go. Other countries, I'm sure we'll be able to pick out which these countries are. This one over here, yes. Hands up who gets what that one is. Yeah, you got that one. That's Scotland. There we have Wales. And over there we have New Zealand. Really interesting examples of small countries trying to get a way of, particularly devolved, but New Zealand obviously on its own, trying to think about how they manage well-being. And I'll give you some examples of what that's about more generally. Let's go on. So the OECD, they've done this whole policies, better policies for better lives. Only 2 OECD countries now not measuring well-being. So good stuff. Sustainable Development Goals. Goal 3, ensure healthy lives and promote well-being for all at all ages. We now have World Happiness Reports, Jeff Sachs and others doing those. And lots of countries and city-states looking at all of this. Let me go on to look quite a focus at Scotland and Wales. These are the kinds of things you'll see, kind of wheels and circles and all the rest of it. And let me go on to do, this is the one that's getting some coverage at the moment. This is New Zealand. A guy called Gabs McClough, who used to work for me in Treasury, went out to be the permanent secretary in New Zealand Treasury, has just come back and has been made central bank governor in Ireland, interestingly. And the one person we all love at the moment, which is the Prime Minister of New Zealand. She worked in Cabinet Office. I didn't know that when she was working there, embarrassingly enough. But she's obviously well trained. And New Zealand's at the forefront of trying to build its budget around these 4 capitals. And what you're finding is that governments find it quite difficult to make the move towards a subjective well-being measure, to saying we are trying to maximise subjective well-being. The kinds of steps they're happier with are these sorts of things. Now, there's an interesting paper by a guy in Australia whose name I've forgotten, embarrassingly, where he says there are 101 of these different things where you've got wheels and you've got different kinds of people saying, well, well-being is a function of, and they look at health expectancy, health quality, healthy life expectancy, various other measures. And if they've got 4 measures, they give them all a weight of a quarter. If they've got 12 measures, they give them all a weight of a 12th, right? It's kind of like, this is part of the problem of this, is how do you weigh them all together? Andrew and I actually did something on how you might weigh the ONS crashes together. But it is a problem, and most of them feel that they want the well-being approach at the moment. Governments and politicians are happy with this being multifaceted and looking at these different aspects. And they're quite nervous about the idea of being driven by a subjective well-being measure. So that's the kind of challenge at the moment. But these interim steps, for me, are quite good. They're certainly better than looking at GDP. I always use the example of GDP, where we've now put illegal drug activity and prostitution into GDP. So all of you volunteers out there, stop volunteering, get into illegal drug activity, and we'll get GDP up. That'll be great. It's obviously just stupid, so we should forget about it. It's great, it's an activity measure. But these sorts of things you're getting. Now, I did a podcast recently, and I'm sure you all listen to your podcasts, for Ed Miliband, because one of the reasons I want to do this is his podcast called Reasons to be Cheerful, which I commend to you, is that I had a discussion about this with Ed some time ago when I talked to him about this, and he was very dismissive of this subjective stuff, too fluffy. And this was kind of from the New Labour, well, the brown version of New Labour, part of Labour. And he goes through and he talks about the New Zealand case. He has some, he interviews the New Zealand finance minister. And actually at the end of this, it's worth listening to, because he does come around to understanding that actually there is something in this. So politicians are starting to move as they analyse this sort of work into, actually there might be something about this. So final point, what if we really took it seriously? If you were actually going to run governments so that you cared about subjective well-being, what would you do that's different? Well, first of all, you'd spend a lot more money on prevention. You'd look at schools. At the moment in schools, we measure children on vast numbers of arrays in terms of exams, and we publish league tables. We do not measure the children's well-being, right? There are lots of ways you can measure children's well-being. We could then say to schools, why don't you have the objective of trying to improve the well-being of your children? Some people would say, yeah, but how are they going to get on in life? I mean, they might be happy, but they're never going to make it a career and a living. And well, actually, it turns out the ones who've got high well-being do better in exams. And if you look at their future predictors of their income, turns out their well-being at a young age is a better predictor of their future income. And that's a lot of the stuff that's in the Origins of Happiness, the cohort work that Richard Lau and others have done. So there's a lot of it would be about education, changing that to start focusing on the well-being of kids, which would mean we pay a lot more attention to things like physical exercise, which have been shunted out. The Michael Gove reforms, like, really important. You learn some of the classical stuff, traditional stuff, for which there isn't really much evidence, but the well-being stuff, there's enormous evidence that if we change that way, it would be good. You look at what it means for welfare policy. I mean, it's quite dramatic, all the things that you can go through, the whole of what DWP spends its money on. And if you combine some of the well-being stuff with some of the behavioural things, then you get a very rich area of policy. I would say it's got to be the right way round. So the trouble with the behavioural stuff is a lot of the nudges that people came up with were measured in terms of their changes to behaviour without thinking about whether these enhanced sustainably the well-being of the individuals themselves. So, for example, you might get nudges which change people's behaviour, but actually, in the long run, didn't enhance their well-being because you'd nudge them away from doing something which was wrong, but if they'd been allowed to do the thing that was wrong, they would have learned, got better, and actually themselves learned not to do this. So we sometimes, some of the behavioural changes I would say have been slightly misplaced. So what we need to do is have a proper well-being framework and then we can get it on. Now, that would mean my final point about can you implement this? Well, it's the first thing I worked on in the Treasury was the Green Book. I did some stuff on how you would incorporate risk and uncertainty into investment appraisals. Now I'm really pleased to say they put into, so how would you actually enhance a standard social cost benefit analysis where we measure time savings and stuff like that into a proper well-being analysis. Just to give you one example of why what we do at the moment is completely stupid, right? You take health. You're measuring whether a new drug should be given to patients or not, right? So how do you determine whether we let the new drug? Well, we have NICE. God bless NICE, National Institute of Clinical Excellence. What will they do? Well, they'll look at the cost of the drug and what's the benefit? The benefit is measured by quality adjusted life years. So they work out how much How long will this keep people's life going? And they look at how good the quality of that life is. They're using subjective measures for this. So we've got a QALY. We have a cost for a QALY. And we use that for determining whether a new drug can be prescribed or not. But we don't use it for whether to build hospitals, whether to spend more money on prevention, a behavioural program rather than drugs, right? This is where well-being analysis will make a huge difference. So we're wildly inconsistent. We do really dumb things in health policy because quite often, and if you look at what politicians promise on health, it's more doctors, more nurses, more hospitals. Come on, what we want is less doctors, less hospitals, less nurses. We actually want a society where they're not going to hospital. It's a very dangerous place and you can't sleep, believe me. And the food is terrible. Finally, it's not just about governments. Let's look at the private sector. I happen to be proud chairman of Frontier Economics. Any Warwick students here, this is where you should go and work. If you can't work in the GES, come here. We take it seriously. So we've got a whole program on well-being activities, campaigns, videos, food. We used to give people free biscuits, now you get free fruit. And we're experimenting with what that means for people. Do we change their behavior? A lot of stuff on mental health, resilience training. Now, the interesting question for me about the private sector is there is a lot of evidence that if you improve the well-being of your staff, you improve their productivity. Question mark. So why do we have to do anything? As economists, surely the market sorts this out. If companies which are doing really good well-being activities have higher productivity, how come they don't squeeze out the rest? And that's, I think, a really interesting question. And that, to me, will give us the answer to what we should be doing on private sector stuff. And people are working on that. So I think that's really important. And the final part is, so that was the private sector. What about the charitable sector? And this is a plug, I think, for another, it was a Warwick student, wasn't he? Andy Haldane. Andy is a founder and member of a charity called Pro Bono Economics. I am the chairman of that charity. What we do in that charity is we enhance the power of economics to improve well-being. So we work with Place to Be, for example, children's mental health issue. We are now trying to kind of search out those areas where we think the charities will make the best impact on well-being. And what we do for those charities is to help them about measuring their impact. And because charities are very, very good, they're very passionate about various different things, but they're really not very good at collecting data and doing analysis of data. That's just not what they went into the charity for. They're passionate about preserving the memory of Uncle Bob. And it's like, oh, that's really an outcome that's kind of tricky. But, you know, if it's about improving access to physical education in schools, for example, then we can kind of go at it. And also, not just measure number of playing fields that they've saved, but actually trying to take it through all the way to well-being gains. So that's where we are. It's a work in progress. I'm working on trying to get the politicians interested. Getting the public interested is something that a lot of people are working on, and you'll see a lot more of the literature on this is about trying to engage with the public on my 5 steps, remember. Winning the intellectual argument is really, really important in all of this because there are still issues, as Andrew said, lots of things we don't know the answers to. Trying to find the determinants of well-being, sustainable long-term improvements in well-being is really crucial. And there is a lot of research, and in terms of the governments, if we could just get a government that would improve, that would actually say they wanted to do this and then we could monitor them against it. But I'm not entirely hopeful for the next couple of years. Thank you.